All right, so most of you may not even have heard about this, something called PAD, which is peripheral arterial disease. What does that mean? You've heard of people having heart attacks, you've heard of people having strokes. What really happens is our blood vessels, our arteries mainly, can get a condition called atherosclerosis. What does that mean? It's like rusting of the pipes. Similarly, those arteries that rust and block and stop blood flow to your heart and give you a heart attack, or to your brain and you get a stroke, the same thing happens to the legs. And one of those things are, most people don't realize it, but they'll start getting pain in their legs when they walk. That condition can progress to the point that people lead up with amputations. Unfortunately today, given how life is, diabetes is prevalent. That's an underlying condition. Smoking, obesity, all these conditions lead to atherosclerosis, which leads to blockage of the arteries. When it happens in the legs, we call it peripheral arterial disease. The problem with peripheral arterial disease is a lot of it can be asymptomatic. You want to catch it really early, find ways to treat it very early, prevent the progression, but also make sure that you don't land up with an amputation. That's where we specialize, and we use minimally invasive options, which is avoiding open surgery, which is not necessary, but actually taking care of it. You've heard of angioplasties that are done for the heart. We do that for the legs. We put stents in there. There's all kinds of new advanced technologies, lasers, etc., that can do to keep the arteries open, prevent the progression of the disease, and make sure that the blood vessels are flowing well and the limb is intact. All of this is now done in an outpatient setting. You literally come there for a few hours and are back home the same day walking. And that's one of the advances that's happening. Peripheral arterial disease for you right there.